Okay, we are going to talk about this particular deal that the United States is moving around the continent of Africa from one country to another. Zimbabwe, Zambia, Kenya, Nigeria, Ghana, even to Burkina Faso. Ghana has just rejected the deal, this health deal. And when you look at the health deal, you will realize that it has different draft terms, but there's all the draft terms have something in common. Some countries are disputing it, and some have rejected, and some are considering it, and some fought and they reversed the draft term. Ghana did not reject this health deal because it is coming from the United States of America, or it is coming from the West or from the East. No. The deal was rejected. Ghana have to pull back. In the middle of the deal, there was so much pressure, according to report, on the government of Ghana. And the government have to pull out by force and say, hey, we are not going to do this. They cited certain things that other countries are also complaining about, which is data sharing, data sovereignty. What exactly is going on? Let me give you the full fact-based breakdown right here of the situation with clear detail, then you will understand. What really happened with Ghana and the US health deal is that the United States of America proposed this health agreement worth about $109 million US, and it's going to span over 5 years deal right here. And this, according to report and then according to the narrative from the United States, it is part of their broader policy, and this policy is called America First Global Health Strategy. Now, the goal of this health agreement or deal is or was to support HIV/AIDS support, all right, malaria control. Malaria, that when you take bitter leaf, there's bitter leaf in the corner here in my backyard in Africa here. Once you take bitter leaf, you you swallow it, you drink it, you are fine. Yes. Malaria control, tuberculosis and polio response, you know, give you injection once you are born, polio, then everybody will be collecting vaccine unnecessary all over the continent. Now, why did Ghana rejected it? According to the data I have and the report I have here, if you're with me, kindly hit the like button and subscribe to be part of this awesome family. Okay, number one is about data control. This is very important. This is one of the things that many people are talking about. Rejection is centered around sensitive health data access. The deal required Ghana to share citizens' health data with the United States of America. And this data we are talking about, family, it includes disease data, population health information, possibly pathogen, that is virus and bacteria data. Ghana saw this, and according to the Ghana government, this is too risky for national privacy and sovereignty. What is it? Why is the United States interested in our data? What is going on? Number two, there has been increase in pressure or increasing pressure during the negotiation between Ghana and the United States of America. The talk started normally in late 2025. So this is not something that started this year, 2026. But the whole thing started 2025, and it was a normal talk. But later, according to report, there was strong pressure from the United States to the Ghana government to accept the terms of the draft term. I mean, the draft term, they should accept it. And to even make it a bit more worse, the United States set a deadline to the Ghana government, which is April 24th, 2026. But guess what, lovely people? Ghana ultimately said, no, we are not going to allow that. The officials, the Ghana government, the officials, they raised concern about the fear of the loss of control over their national data, external influence over Ghana's health system, and the long-term dependence or hidden conditions regarding this particular deal as it is brought on board. Now, the big issue right now, it is not just about Ghana. When you look at it, this is kind of a wider African pushback against this particular health deal that the United States is moving from one country to another with different health draft term, but the data sharing is one thing that is common when it comes to this particular health crisis. When you look at the countries that rejected or resisted this similar US deal, not because the deal is coming from the United States, but they have problem with the draft term. You have Zimbabwe. Zimbabwe, for example, rejected this deal worth 350 million plus health deal from the United States. The main reason is the same kind of things. The US demand access to sensitive health and virus data. Then Zimbabwe said they are not going to allow that to happen. They can't do that. So they said no. Zimbabwe said this threatens their national sovereignty, and therefore if the United States can change and add a little bit of track of change to the draft, they can accept the deal. There's one thing also hanging around the deal. This is a deal that, according to report, there is no guarantee that they will benefit from it actually. Yes, it is going to result into loads of vaccines to your citizens. Anyway, Zambia, for example, Zambia rejected, or let me say resisted, this bill worth 1 billion plus deal. So you realize that every country they go with its kind of money. 350 million US dollars in the case of Zimbabwe, Zambia, 1 billion US dollars. Ghana, for example, our own is worth what? 109 million US dollars. In the case of Zambia, the same thing. They rejected it because of the concern, which include data access by the United States up to for some years. Okay, and their case is a bit worse because their condition, the condition laid out by the United States, design structured in the draft term, is tied to economic sectors, which include mining. Resource must be involved. What thing concern health, medicine, and mining? Clear, right? So when you look at it, the opposition in Zambia, for example, stood and said this is going to be kind of like exploitative and imbalanced deal, so the government should not accept it, and therefore they rejected it. Now we come to Kenya, for example. Kenya initially, according to data here, Kenya signed the deal, but the court in Kenya suspended it over this same data privacy concern that it violates national data sovereignty. So they argue also that it lacks transparency. I mean, things are not clear. So there are other countries also like Nigeria, Uganda, Rwanda, for example. They didn't reject it right out, but they also raised this concern about data sharing, which they say that, or they say to the United States that no problem, revise the data sharing because that violates our national sovereignty. And Ghana also took that stand. Burkina Faso accepted it after long talk, and draft term was revealed to respect the sovereignty of the nation. I published that already. We are not going to talk about it. But why is the United States moving up and down, trying to get our data? Why are they interested in it? What is going on? And when you look at the draft term of this deal, it involve the co-investment requirement, which simply means that the countries that will accept this deal, they must fund part of this health system themselves. The United States will fund part, and you also will fund some part of it. And over time, the United States US funding will be reducing over time. And according to them, it's something that they want to do to help the countries become self-reliance and not dependence on Western aid or kind of things as they put it out there. I'm only asking the question, when did the United States start trying to make people independent and not dependent? Well, and there is one thing also about the deal. When you look at how the deal is moving from one country to another, you realize that there's no guarantee. So to some countries, let me put it that way, to some countries, when you look at it, there's no guarantee of return benefit. All right, the only benefit connecting it is kind of your citizens receiving medication and kind of things that are connected to your, how do you call it, your health sector. But it look like pharmaceutical companies are coming to make money out of your country kind of thing. So the deal is not so clear. Why? Because it doesn't carry one particular agenda. Every country with their a vibe that they approach them with. So Ghana has rejected this deal, and this is something that we must applaud, that we have a government who is so conscious of the fact that our health data need to be protected, and they are doing that. We appreciate that so much. But this rolls us back to one thing. You see how they are moving from one country to another with different kind of draft term, assuming we are united as Africans. The United States is coming to deal with Africa with the head. The draft term will not be moving from one country to another. The draft term that the United States will give to Nigeria will be the same that Burkina will receive, the same that Nigeria will receive, because there's going to be one head to negotiate this on behalf of Africans. So we are speaking with one voice. It is not going to be many draft terms that will include different things depending on the kind of country. This is why it is necessary for us to what? Come together as a continent. But why is it that the United States of America, being aware of the fact that the draft term, the things listed in the draft term, which include data sharing, is against the policy of these countries, it violates their data sovereignty, but still went ahead, and even to the point where they need to pressure the countries like Ghana, for example, and Ghana have to pull out. What started as a normal talk between the United States and Ghana, all of a sudden pressure mounted, and Ghana have to pull out and say, hey, we are not going to do that. If the government were to be weak, then our data would have been, shared without our consent right here. People will sit down and take decision on our head. But thanks to the government, John Dramani Mahama and his team, for rejecting this. Is it a thing that the black man cannot produce its own medicine? I mean, why should we leave our health in the hands of people? Why can't we produce, heal ourselves? Is it that we lack the capacity, or we just decided not to do it? Or it is that it is programmed that we will rely on on foreigners for our health? The person who feed you and take care of you when you are sick have so much power over you. At least it is time where we have gotten to right now to start producing our own medicine and then sorting ourselves out. So, family, the question remains, why is the United States going about this from one country to another, knowing very well that, or knowing fully very well that it is against the principle and the sovereignty of the nation? We want to understand. Let me know your thoughts in the comment section. Respect.